My name is Joshua Unger. I'm a vascular surgeon at the Memorial Cardiac and Vascular Institute. My first job was as a physics teacher at a high school, and my second job was as a computer scientist. After doing all those jobs, I was in a hospital helping take care of a sick friend, and I got to see what physicians were doing and other healthcare providers were doing to take care of my friend, and it made me think about my career choices. And I went back to school at night while I was working full-time, and then I eventually led to medical school. The first night that I did as a medical student on the surgery rotation was a liver resection. Just seeing what you can do in surgery, I just knew that it was surgery for me. In the last 10 years, there's been a move away from traditional open surgery towards minimally invasive techniques, stents, balloons, devices to clean out the arteries. And that's an area that we're at the cutting edge of at Memorial and the Cardiac and Vascular Institute. I'm personally involved in some projects that could be on the frontier of vascular surgery, where I trained. One of my professors had developed a alternate dialysis access made out of human tissue that does not have cells in it, so it doesn't have much risk of rejection, and could be the first new thing that had come along in dialysis access in the last 50 years. And then the other thing that I'm interested in, being very aggressive about limb salvage and working together in concert with the Wound Care Center and the Hyperbaric Center here in order to prevent an amputation in patients who have problems with their circulation. For the best outcome, it's very important for my patients and for me to really connect and spend time to figure out the best treatment plan. Sometimes I meet a patient in the emergency room and we have to quickly establish a connection, but I have to look at it as trying to be calm in the middle of an emergency situation and provide confidence for the patient that we can guide them to the right treatment. Whenever I meet a patient for the first time, I know it's not a chance encounter, it's establishing a relationship. Over the course of my career, I've gotten to know a lot of families and patients, and it is rewarding to know that the patients can go back to their quality of life that they've had before.